what's your take on rural healthcare? And let's focus on Tennessee because that's where we are, and
Sure.
we have plenty of opportunity in Tennessee.
Sure.
What does it look like?
Well, I think it has to look different than it has in the past. So if you think about the hospitals that are closing, many of them are in small communities, but they just can't sustain a large hospital. So I don't think we can look at healthcare and rural healthcare the same way that we have the past 20 years.
So a lot of the conversation's been around how do we sustain, how do we prop up the rural healthcare facilities.
Right.
Is it better maybe to think about how do we provide rural healthcare in a different modality, if you will?
Right. I mean, think about telemedicine.
Yeah.
Do you really need a doctor's office in the same physical structures that we have today in many rural healthcare settings to provide great care? And I don't know that you do. I mean, I think there are technologies that are available that can do that, that we can look to for future success.
Yeah, I saw an interesting article this week actually on Walmart. They're expanding their clinic in a Walmart in Georgia to provide both healthcare, dentistry, and mental care, all in Walmart. So you think about it, though, when you're thinking about rural healthcare, I mean, name me a community that doesn't have, a rural community that doesn't have access to a Walmart.
Right.
So could they be part of the solution there?
Well, and maybe so. They've got the infrastructure. So if you think about it, they've got the
thousands of stores.
Right, and they've got the network speed often, that would provide
connectivity.
For the bandwidth, and it's in the right geographical place, and it's where people go today. So maybe so.
Yeah. No, I think with technology changing the way it is, I think there's a lot of opportunities that we have to look at rural healthcare differently.
Right.
To where the old model of, hey, we have to have a hospital or we have to have this structure or that structure, can you do it differently and still provide the access that you need to be able to provide to the people in those communities?